You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello and welcome back to Girls with Grafts. I am Rachel Kudlak and I'm one of the hosts of the podcast, and I'm joined today by my lovely co-host Amber Wilcox.
Hi there. So excited to be recording today's episode for all of our listeners out there. We have a really exciting special guest. So Rachel, without further ado, I'm going to let you start the show.
Yeah. And before I do introduce today's guest, I do want to give a special shout out to Spalding Rehabilitation Network. Spalding is one of our Phoenix partners and is a world leader in advanced rehabilitation treatment and research, and they serve the greater Boston region and beyond. And today's guest knows Spalding very, very well because it is Dr. Jeffrey Schneider, who is the Medical Director of Burn, Trauma, and Orthopedic Rehabilitation and the Director of the Rehabilitation Outcomes Group at Spalding. In addition, he serves as the Division Chief of Comprehensive Rehabilitation and Associate Chair of Physical Medicine and Rehabilitation at Harvard Medical School. His research is focused on the long-term effects of a burn injury, which we'll be diving into. And he's also the principal investigator and project director of the Boston Harvard Burn Injury Model System, which is a multi-institutional clinical and research collaboration between Spalding, Massachusetts General Hospital, Brigham and Women's Hospital, Boston University, and Shriners Hospital for children in Boston. Sorry, lots of Boston, lots of rehabilitations. I think I made it through good enough. But thank you, Dr. Schneider, for joining us today.
Thank you, Rachel and Amber, for the opportunity to be here and talk with you today and for the kind introduction.
Yeah, we're so excited to have you, Dr. Schneider. So I know you're a familiar face, or in this case, for those listening, a voice for the burn community. But those that don't know who you are, can you share a little bit about your background and how you got involved specifically in the burn community?
Yeah, great question. So I've been a doctor for over 20 years, and I work, as you said, primarily at Spalding Rehabilitation Hospital. My specialty is physical medicine and rehabilitation. So in caring for people who have had major injuries and really require long-term care and recovery from those injuries, and for some people years after their injury. And actually, when I was in training as a resident, had the opportunity to care for a number of burn survivors who survived the Rhode Island nightclub fire at the Station Nightclub. And those are the first people I ever took care of who were burn survivors, and that got me interested in this population. I did a study following up some of the over 100 burn survivors from the station, or survivors of the Station Nightclub fire. Some of them were burned and some of them were not, in a research format. And ever since then, this has been an area that I've really focused on and been interested in trying to help the burn survivor community just, live their best lives over the long term after their injuries. So,
Yes, and we've had Gina Russo on the podcast a few times, so our listeners know a little bit about, her journey in the Station Nightclub fire. But working with you, I've had the pleasure of knowing you for a few years now, and I know a lot more about your research side of things and that focus. And like I mentioned in the bio, you've been you focus on the long-term effects of the burn injury, and the Boston Harvard Burn Injury Model System. Can you tell us more about what that collaboration is and some of the research that goes into that?
Yeah, sure. We're really fortunate to be funded by the federal government to do this research. There are 4 federally funded burn model systems across the country. We've been one for a little over 10 years now. And these are they're called center grants. They fund sort of a center to focus on really learning and advancing the care and research of people with burn injuries over the long term after their injury. And so, yeah, it's a collaboration. So, here in Boston, as part of the Boston Harvard burn injury model system, we work together at Spalding with colleagues at the Mass General Hospital and Brigham and Women's Hospital, um, and the BU School of Public Health. And really, the idea is to bring together lots of different types of specialists, different ideas. I'm a rehab medicine doctor. Some of my colleagues are surgeons. Others are, health policy people and design people who design metrics, as well as burn survivors are part of our team. So it's a really unique kind of collaboration, and we're very focused on advancing the life of burn survivors, over the long term, and better understanding the issues that people face. I mean, for a long time, just really learning what those issues are has been a big advance. And designing interventions and ways to help people live their best lives over the long term. One of the unique things that the burn model system does is we've been collecting information, data on burn survivors for their life after their injury. There's over 6,000 burn survivors that have contributed to this burn model system database. And that's like such a rich resource, which helps us understand, what are the issues that people face, so we can really think more about how to better address them.
That's great. Yeah, I believe I was part of the injury model system myself and got involved through Phoenix Society. I will say, I guess from that research that you've gotten, do you have areas where you've defined as the greatest need for burn injuries? And can you share some of that with those that are listening today?
Yeah. For one, I think like partnering with burn survivors to better understand what those issues are is really important. And I think a lot of research hasn't historically involved that type of partnership. One really good example from our group is, one of our collaborators and a burn survivor was asking us about having fatigue symptoms and said, I really have such fatigue, what is the deal with this as it's related to my burn? And we went and looked in the research literature, and there was really nothing written about people with a burn and fatigue. So, that's kind of interesting. So we looked through this database, and actually we have a questionnaire we've been asking people, which has been used historically to measure symptoms of fatigue in people with chronic fatigue syndrome. But we just took the same instrument and said, how many people actually with a burn injury have these symptoms? And we found 2 years after their injury, almost 50% of people in this database were still reporting fatigue symptoms. So, it's a great example of just learning from people that we're taking care of and partnering with them to really try to better understand their issues. You think about what are the biggest needs. I think that empowering burn survivors to live their best life is really more and more how I think about contributions that we can make. The project that we are focused on in this grant cycle where we've been funded as a burn model system, we're starting to develop what's called a self-management program where, I think every burn survivor is unique and has their own sets of issues, and no two people are exactly the same. And so it's hard to design maybe an intervention that fits for everybody. That makes sense. But this idea, I think, does fit a lot of people because the principle of it is that we, through training actually other burn survivors to lead a self-management program, they become leaders of this, and then they lead sort of an online program that occurs over the span of around 6 weeks, where people are empowered to sort of better manage their own situation and the challenges they face. And it's more about, skills to manage challenges than it is about what those challenges are. So people could have mental health challenges or physical issues or social issues or totally, monetary things about money and finance. It could be anything. It's really just about problem solving and how to manage those. And so anyway, we're hopeful that that's going to be a really helpful intervention for burn survivors. It's been used in people with lots of other chronic conditions, but it's never been tested in burn survivor population or other populations with traumatic injuries. And so we're excited to sort of trial that.
Yeah. Yeah. And I love the idea too of putting more power, like self-power, and being able to not necessarily self-diagnosed, but understanding more on your own, and to identify some of those symptoms. So, we asked you and you talked about, what understanding and areas we still need to get a better understanding of. But throughout your research so far, has there been any, really great strides in a particular area that we really have figured out now? Or I guess what's been maybe some of the successes of the research you've done so far?
Yeah, that's a good question. I mean, I would start by saying that there's always more we need to learn. And I come from a perspective of always feeling like we're not doing a good enough job. We always need to do a better job. So, one of the things that our group has been involved in is the development of an instrument, a fancy questionnaire called the Libre. It stands for Life Impact Burn Recovery Evaluation. And it was designed with a bunch of my colleagues here in collaboration with the Phoenix Society and with other burn survivors locally and nationally, as an assessment to better understand burn survivors. And we call it social participation. It's like a fancy term to describe sort of how people are living in their lives. When I look at, the focus of a lot of clinical care and research, I think for a long time it's really focused on things related closer to the hospital period and when people are hospitalized, and then a lot of physical complications like a contracture, very important. But a burn survivor might not come to me in clinic and complain about their range of motion being 20 degrees or 30 degrees off of normal. They're really talking about, like, can I get back to my life? I want to get back to doing things that I did before, or my relationship and how that is, or work, and so those are really the issues of social participation. And so this is an instrument that's designed just for the burn survivor population to better understand. We divided this social participation into 6 different areas: your relationship with family and friends, romantic relationships and sexual relationships, work and employment, what else? Social interactions and social activities.
Yeah.
So yeah. Sorry, I had to off the top of my head, but it just sort of really tries to capture different aspects of people's lives and what they're trying to get back to doing. So I think that's been a really important contribution, because if you can't measure something, you can't actually figure out how to make it better. So that's really a major first step. And there were over 600 burn survivors who contributed to the development of that, in addition to organizations like Phoenix. So, it's been a really big effort of people really across the country. So we're really grateful for that. But we're hopeful that's going to really help target more interventions in the future to help people.
Mm-hmm. Yeah. Absolutely. And I know, we've used, those 6 buckets and categories in some of, our research, and our, even when we're working on developing blogs and articles for the website. And, those 6 areas are, 6 main needs of the burn survivor community. And, for some, maybe the social interaction and activities are the biggest challenge. And for others, it may be returning to work. So yeah, we've used those 6 categories a ton. Would you say there's maybe one category in particular that, we need more information on, or what are your thoughts on that?
That's a great question. I don't know. It's hard to single out a one category. I think for each person, like you said, it can be different.
Yeah.
I mean, everyone's different. I think that's sort of the key, is sort of, it's like a profile. Each person might have different needs, or everyone has their own strengths and weaknesses in their life. And, so.
Yeah, I may have a solid relationship, right? Like kind of model there, but somebody else may have that very differently in how they've recovered. So I think, their experiences also probably contribute to that, right? Oh, sorry.
No, I was just...
Go ahead.
I was just going to ask kind of what is maybe next for Libre, or if someone's listening and, we've talked about Libre a lot with, some of our community members, but, if they're new to the community, or this is the first podcast they're listening to, what's next for Libre, or how can a survivor get involved?
That's a great question. So I think one of the next steps is, and we're starting to do this, is to use Libre as like an outcome. It helps us really to, scientifically just assess how someone is doing. And we can try new interventions like this self-management program and then measure people's Libre scores before they had this intervention and after to see like, is it really helping them in these different domains, these different buckets of social participation. So I think that's a big one as a test to assess an intervention. Is it helping people in these ways? The other one, there's a couple other ideas. One is, for clinicians to start using it in clinical practice. Like we have a colleague, he's a psychologist in Washington, D.C. His name happens to be Dr. Schneider, also, we're not related, Dan Schneider. And he started to use it in his own clinical practice where he sees a patient and he administers the Libre and then helps him decide things to focus on with his patient, what things they should address, and then to assess it later and see how they're doing and use it as feedback to his patients too. The other idea that I think that might get used in the future is also just for burn survivors themselves to use it and just as a tool to help them understand how they're doing. The scores are scaled to compare them to other burn survivors. So sometimes people might be reassured in knowing, how I'm doing is similar to other people, or, this is an area that I need help with. Maybe I should seek help from
Reach out and get help.
Yeah, help me understand, someone understand the context of how they're doing. So I think there's lots of ways for it to be used. And there's probably many others I can't even think of, but those are
I like the idea of the doctor asking that progress, right? Because I think my medical team did some of that, right? Of like, how are you progressing in certain ways? But there's more of an emotional aspect that I feel like would be helpful for a medical team to ask, to be able to route you in the direction of like, hey, we have, these programs or things like that that could help. Because I think there's a lot of physical, right, check-ins, but like in terms of the emotional check-in, I think there's a lot of work that like the healthcare system can learn from like some of this research of like, hey, you can ask me how I'm physically doing, but have you asked me emotionally? I think that's a really important part of it. And that is, a good aspect of my emotional healing too, right? Like if I'm emotionally, or like when my physical healing, if I'm not emotionally doing well, I'm not going to want to get up and go try to work out or do things to kind of get better. So I think they play hand in hand very well as well.
Yeah. I also wonder, I think it's a great, Phoenix, you guys also have really great programs, social skills, various other things that I know you guys are always developing new things. That's one idea that maybe you might try. Like maybe you would use it as a way to see how people might be benefiting from different programs that Phoenix offers or other organizations are offering. I think this is a good thing, but I think increasingly a lot of things are being offered outside of the medical system. It's in the community. I think the community is such a big part of burn survivors' recovery. It's not just the medical healthcare system providing this.
It's getting involved with other
beyond, the hospital and the providers in a hospital clinic. So, like you said, Rachel, like empowering the burn survivors to be the agent of their own recovery is a big part of it too.
Their own advocates. Yeah.
Well, and I think too, Amber, when you're talking about the healthcare teams asking with some of these assessments, I think this would be a huge help because, with the physical healing, there's more, it's black and white when you can see your physical healing getting better. You can see your scars healing. You can see your skin stretching better or whatnot. But when it comes to the emotional and mental side of things, like we don't have the same type of benchmarks as we do with the physical healing. So having anything, I think, is a great start of just like, okay, look where I was, we talk about journaling all the time and looking back like a year ago to see where you were. And, I just think the more I don't want to say assessments, because then I feel like people just go away from that because it sounds like a test and it's scary, but having those benchmarks, I think, can really help see, growth.
For sure. Well, another area that you've discussed before, and I know as someone who's like been in the community for a little bit of time now, I hear this question come up all of the time. Are burns like considered a chronic condition? And so I'd love if you would help us with like, what does that mean? And what is that by definition, like chronic condition? Can you help us explore that a little bit? Because I think that's something that our community would really love to hear from an expert like yourself of what that truly means.
Sure. I would start by saying that, this is not for everyone who has a burn injury, would necessarily consider it a chronic condition. And, a bunch of people in this field who care for people with burn injuries have started talking about this issue more. And I think using that term is really to try to advocate for burn survivors and getting the care and the resources that they need over the long term. And we've learned a lot from like other groups and populations. There's some of my colleagues take care of people who have spinal cord injuries and traumatic brain injuries. And these groups have gotten historically more like funding, federal research funding and more attention. Certainly TBI has gotten more attention through wars and things like that. And anyway, they've started to adopt this idea too. And I think the idea is that I think long ago, but sometimes more recently, people used to think of a thing like a traumatic injury, like a burn, as an event that happens in a point in time, and then it heals and it's done, And I mean, I think that's great for some people. That is the case, and certainly for some people with more minor burns, that could be the case. But some people who have more significant injuries, like we said, the Libre, it can affect people all sorts of different ways, and it can affect them for long periods of time and different ways for everyone. And I think this idea of the chronic condition is just to say that, it can last after people leave the hospital. Sometimes people just have like one or two follow-ups in their clinic, and then, they're back to their regular primary care general doctor to see. And this sort of acknowledges that, even beyond, I think people would say after a year, people are considered to have a chronic condition, that people continue to have issues, physical, social, psychological, mental issues related to their burn injury that can last beyond that year. And, to start to name it that helps us sort of advocate for resources and funding and care that would, address the issues that continue for some people.
Mm-hmm.
I don't know. That's my first answer to it. I'm happy to talk to you more about it, but
yeah. So is that why, maybe burns aren't classified as a chronic condition right now, is because there's such a wide range of a burn injury, from a very minor to a very severe burn injury? Is that why?
Yeah, I mean, that can be part of why it is, although some chronic things that are classified as, there's a lot of like nitty gritty on these things that sort of over my head too sometimes. But, there's, for example, the Center for Medicare and Medicaid Services, federal insurance for Medicaid and Medicare. They have a list of chronic conditions, and burns are not on that list currently. But no, I don't think any other traumatic injuries are either. And a lot of policy things, like when laws are passed that support funding for long-term burn survivor care and the needs of these longer-term issues. It stems from these types of issues, like putting your name on a list. Sometimes can help with those things. I'm not an expert in that. I think that one of the things we can really advocate for as a community, as burn survivor and the clinical care community of burn survivors, is for changes, I think, in policy to more support, burn survivors over the long term. Would think like the questions I have are things like, would something like, let's say, this self-management program as an example, let's say we find it's really helpful. Would that be supported by someone's insurance? Right now, probably not. But, the more we can advocate for this to be recognized, I think those sort of things might come down the pike. I always wonder,
sure,
would even a gym membership be helpful? Why can that be? These things might be really great things for people.
What recommendations do you have for folks that, are experiencing these long-term issues, but not recognizing, right? Or it's not being recognized as that per se, like chronic condition. I know advocacy is a big part of it. Where do you start when it comes to advocacy? And you may not know the answer, but maybe you've done some work in this.
Yeah, I know some of the answers. I definitely don't know all these answers. I open to your ideas about this too. I mean, one thing is I think the burn survivor community can be a real strength for a lot of people. I think
For sure.
one of the things that I often recommend for the patients that I take care of is try to get them connected to the burn survivor community. I think that's can be really invaluable for people, even people who are skeptical of that kind of thing. And I'm not really interested in a group session or talking about my issues to other people. A lot of people I find are actually surprised themselves. They didn't think they'd be into it, but they surprise themselves and find it a worthwhile connection. Never be afraid to ask your providers, your clinicians, hey, I have this issue going on. I don't know what it is, or I don't know how to address it. You can always start there.
Mm-hmm.
And I think, there's always research going on. I'm happy for people to connect with our group. If you're interested in participating, it helps us learn more about how to help people. We always have projects that we're trying to learn more from. And there's other groups that are doing great research too. I think those are opportunities.
For sure. And we'll put the link that's on the screen right now in our show notes, because there are tons of studies, like you mentioned, going on all of the time, but also your study, the kind of the overview of the study is also on that page. So we'll make sure we drop that in our show notes. But like Dr. Schneider said, we would definitely recommend that you continue to look and seek out those opportunities, because those are big areas of need for the community. As the more voices we can get together, I think, like you said, the stronger and more kind of like backing we have to kind of continue to push these efforts forward.
I would say, I just want to add, as I would be remiss in not saying this, that a bunch of clinical research groups in different hospitals across the country worked really closely with the Phoenix Society this past year to advocate to Congress to spend more money on burn research. And I think that, we're still waiting to find out how that pans out, but that's the kind of thing that just have to keep working at. And we, with various people at Phoenix, met with Congress people and talked about, the importance of, funding research. And this is the kind of thing that other groups have done historically over time, been really successful. And I think those things ultimately matter. So.
Yeah. And, for those listening, whether you are a survivor or a loved one or a burn care professional, advocacy and research doesn't necessarily mean, going to Congress and sharing your story in front of a ton of people. Maybe it's participating in a research study, which may be a 30-minute survey you complete every few months. It doesn't have to be, big, crazy, wild ideas, but by participating even a small amount, joining our Facebook group and sharing your story with others, whatever it means, the more voices we have in our community, the stronger we'll be and the more we can get done as a group. So I just do want to plug that too. Don't be afraid to be involved in advocacy and research. It's can be as simple as you want it to be. And we want your help. So and I did also want to make sure we plugged, a few years ago at virtual Phoenix World Burn Congress, I think it was in 2021, Dr. Schneider was on a panel discussion, which we'll have linked in our description below as well. But it talked all about, exploring burns as a chronic condition. And that was a really, really great session. So if you did miss that, or if you were there and want to revisit it, that is a great resource we have. So before we move on, I do just want to ask some more questions about the chronic condition. Aside from maybe the insurance side of things, what else would it mean for the community if, burns were classified as a chronic condition?
Yeah, it's a really good question. I think it has potential to really reshape some of the care that's provided. Different care models. We recently are working with some surgical colleagues at the Brigham and Women's Hospital to develop, it's for trauma in general, so multiple different people with different conditions under the umbrella of trauma, including burns, develop more of like a longitudinal quality of life clinic. So it's not just for showing up and leaving the hospital, but more over the longer term. And it's designed to be much more multidisciplinary, and almost like we call it a survivorship clinic. really promoting that aspect of survivorship and thriving. And it's been modeled after, and lots of other medical issues like cancer, and they've really thrived in developing these types of clinics. And it has like a psychiatrist there and a rehab medicine doctor and a surgeon, and then there'll be other different services provided as part of the clinic, having to do with everything from financial issues to exercise and wellness to mental health. So anyway, there are lots of different things we can do to really, and I think we're still learning what's the best way to provide that care. I mean, the older models were focused on sort of addressing the acute issues and lingering wound care issues, but like we just described earlier, there are lots of other things that come up over the long term. And what's the best way to care for people that through that, those experiences.
Yeah, and what advice or what, I guess, tips would you give a survivor who, may not have a local burn center or burn unit near them, and, they do just have their primary care doctor and they want to talk about some of their chronic conditions, or maybe it's not even a chronic condition, but maybe just something that's come back up with their burn injury. What advice or information would you share with them?
Yeah, I mean, one, I think Phoenix and other support organizations are great. Talking to other burn survivors helps understand might help people understand where they are and if this is normal or like other people, or I think a lot of people feel isolated and alone and don't know if what they're experiencing is similar to anybody else. There are a lot of resources online that are free and available to the public. All the model systems have a lot of information that's geared toward the layperson, a non-medical person to read and understand. There are videos, we call them fact sheets. They're kind of like 1 or 2 pagers that are written for a non-medical person to read, just an average person and their family, to understand various aspects of burn injury, from what is a burn to, wound care and itch and pain and mental health issues and various other things, getting back to work. Those are various things people can do. There are lots of things I just would recommend for anyone, diet and exercise are great interventions for most any person in terms of wellness and living a good life. And a lot of people find that, the more they exercise, just having normal activity, it doesn't have to be you go to a gym and, or weightlifting. We can just talk about going for a walk every day or 3 days a week, going for a nice, it can be simple things. It should be something that can be attainable, and one person can do on their own or with other people. I think those things are often really helpful for people.
Yeah. And I see Amber put up, thank you, the MSKTC website. We'll make sure that's linked below. We also have a bunch of the fact sheets available on our website too, in our resource marketplace. So, and they have so many great resources in Spanish, if not all of the resources are in Spanish. So if you are looking for some Spanish resources, that's another great website to visit.
That's right. They're all in English and Spanish, all of them.
Awesome. Yeah.
So Dr. Schneider, tell us a little bit about what a day in the life of your kind of role is, and what research projects or things you're working on right now. We'd love to hear more about kind of your day-to-day.
Sure. I have the greatest job, in my opinion. I love what I do. I do a lot of different things, and that's kind of one of the reasons I really like it. And I'm lucky in that I feel like I am able to help people. So, I take care of people clinically, mostly in an inpatient rehab hospital. So this is a facility here at Spalding Rehab Hospital in Boston. And patients come here to be an inpatient after they've had more serious injuries, people who've been in the hospital for a long period of time after a large burn injury, for example, and then need to spend often weeks here to get well enough to go home. And they have lots of different physical and mental and medical issues while they're here, which I help them manage. And then I follow people after they leave the hospital and go home to the community. And I saw a patient last week who had a burn injury 12 years ago, and I continue to follow her all these years. So some of these patients are, I'm growing old with some of my patients.
That's awesome.
Great. Yeah, some of them, there are issues that come up and they wax and wane. Some people you don't see for a while, they come back and have other things they want to work on. So I get to follow them, and that in a clinic setting too. Sort of as an outpatient, or sort of tweaking other issues or issues that come up over time. And then I'm really fortunate. I'm part of a research group. I help lead the group, but I have lots of people that I work with. I certainly don't do it by myself, and it's great. We meet, a number of times each week. We have various different research projects that we're working on, and we're trying to continually learn from the work that we're doing to really better help burn survivors. And, even some of the work we're doing recently is really bridging into how we think about people with trauma in general. Because I think we're learning about not just from the burn survivor community, but how we could take that and help other people, or what other people are doing can help us think more about what's best for burn survivors.
Mm-hmm.
So that's sort of my life.
That's awesome.
Yeah.
And I'm sure it's awesome to see, those survivors that you did work with, 12, 10, whatever years ago, and kind of see them grow and evolve and just watch their journey.
Yes, exactly. I have on my desk here, I had a patient of mine I took care of 3 years ago who came by the hospital just to visit, who dropped off a card to thank
that's really cool.
The whole staff for all the care. And, he's back at home with his family. And we have a local burn survivor organization, the Burn Survivors of New England. They have a charity walk and a bunch of burn survivors come back together who we haven't seen in a long time, especially with the pandemic. We haven't had this walk charity event in a number of years. So those are nice events, and get to see people. And, it's a sense of community too, which I think is a special thing about the burn survivor community.
Yeah, and I think with you saying you started kind of with the Station Nightclub, right, accident, I'm sure there's a lot of survivors who you followed. I know, like Gina, right, is a good friend of ours and in the community, but she just talked about in her episode that we had how much she's evolved. So I'm sure you've seen the evolution really from the very beginning for some of these patients to where they are now. That's an incredible journey that they've been on.
Yeah, sure. I mean, I'm just grateful for all the patients that have let me be involved in a small part in their lives, and I've learned so much from them. So that's.
Do you find that what you learn in your clinical setting is kind of what you translate then to kind of the research that you do? So, like things that patients, deal with, does that spark kind of some inspiration for you in your research?
Yeah, definitely. I mean, I gave you that example about the fatigue issue in the beginning of our talk, but I think just clinically through my own experience, certainly, but we've also been very intentional in trying to include burn survivors as part of our research team to really be like part of the process at all the time. So I can give a shout out to Diana Tenney, who's a burn survivor and is very active in the burn survivor community. She's our co-director of, we call it dissemination activities. So, how we get the information out the community and other people to know about the work we're doing. And we work with actually an advisory board. And there are many people with burn injuries on our advisory board. We meet with them regularly to help constantly give us feedback about the work we're doing, come up with ideas for what we should be doing. And, that's just an integral part of what we do. Obviously I have a perspective, but I'm not living with a burn injury. And so that's just so important for us to be informed by people living with these experiences to tell us what's important.
Yeah, that's awesome.
We've evolved with them. They've helped us sort of change over time. We've changed the kinds of things we're looking at based on that kind of feedback.
That's awesome. Well, and I know, so at American Burn Association's annual meeting earlier this year, you were awarded the Harvey Stewart Allen Distinguished Service Award, which is given out to an outstanding scientist for their contribution to the burn field. So first off, congratulations again on receiving that award. But secondly, what does it mean to you to have received that award at the ABA earlier this year?
Yeah, thank you. I would say that like all the work that I do is really part of a team, and I really don't do any of it on my own. So I really am grateful to all of the burn survivors and their families who've, been such a big part of the work that we do, and my entire research team that's been part of this work. And, it's like we just at it every day, trying to make a little bit of a difference each day, is slowly moving along. And so, I think it's nice for the American Burn Association to recognize our work in the sense that, we focus more on the longer term issues. And so I think that's an important, as we're getting so much better, I have all these surgical colleagues to thank for the tremendous work they do, and enabling so many more people with really severe burn injuries to survive these injuries. And now we're faced with sort of people surviving, and so managing sort of the issues that those people face long term.
Definitely.
Well, we have some final questions for you, but before we do, is there anything that we haven't asked you that you want to share with the community? Because I know the folks that listen to this aren't just burn survivors, there's clinical professionals and whatnot. And so I'm sure they'd love to hear from you, kind of what you want to share with the community or encourage the community at large.
I don't know. I just say keep telling us about what's important, and one way you can do that is by communicating with your providers and your people who you take care of, help take care of you in the medical world, but also by participating in research or helping us inform what's important. Our group is always interested in your feedback and your ideas, so that's what I would say. I'm open to
Dr. Schneider,
so you could tell me now, or if you have other ideas.
Is there a way to get in touch with the folks at Spalding? I know you said you have folks, you regularly look for burn survivors to kind of participate. What's the best way that you would recommend, and we can put it in our show notes as well, to have folks connect with your team at Spalding? Was it to visit the website that we kind of put in the show description?
Yeah, the Boston Harvard Burn Injury Model System website. That's a great website because it has lots of resources, and it also has a contact us link, which is really easy for people. They can click on the link to participate in research. They can click on the link just to send us a message, ask questions. So that's a great way to connect with us.
And I believe, tell me if I'm wrong, this, even if you're not in the Boston area, you can still participate.
Yeah.
So doesn't, just because Boston's in the name, don't be afraid. You can be located anywhere, and you can help out.
That's right. For example, a lot of the research we've done has been across the whole country. And for example, the Libre we talked about was a national study, and burn survivors across the country were involved, including Canada. And this self-management study, which we're starting to embark on, called the CLIMB study.
That's cool.
Also
I like the name.
National study in Canada. So anyone across the country who's interested, feel free to reach out.
Awesome. And we are also going to link to the Phoenix Society site, where a lot of the research studies that do come out, we put them on that site to get involved. So anyone listening, we will put all of those notes in there, and you can contact Dr. Schneider's team or participate in research online. Well, with that, we do have two final questions for you. The first I have, because I think this is really important, coming from a clinical perspective, what advice would you give a newly injured burn survivor? So I know what advice I'd give, and maybe Rachel would give, but as somebody who's a clinical professional, what is the biggest piece of advice that you'd give to like a new patient that enters the rehab facility?
That's a good question. I mean, I think one is, like, for many people with more severe injuries, just to take it day by day, do your best each day. And if you do that and focus on the things you can do, you have control over, and I'm hopeful that each day ways to make things a little bit better, and that it's not a sprint; it's more of a it's a marathon.
Yeah.
People who end up being hospitalized for a longer period of time and have significant injuries. There's an arc to it, and nothing happens right away. But that said, reaching out, asking for help when you need it. I think those are other important things. Help can be through just family and friends, or through Phoenix or other support organizations, through your providers. I mean, there are lots of people who are there to help with support. I think can be really vital for people in their recovery.
Mm-hmm. Definitely. Yes. Don't be afraid to ask for help.
Yeah.
Yeah. Coming from somebody who I think sees lots of patients every day who are, in that long-term road to recovery. So that's definitely a valuable piece of advice for sure.
Mm-hmm. Yes. And our final question, it's our Phoenix partner question, which today is sponsored by Spalding Rehabilitation Network, who's committed to delivering compassionate care along every step of your rehabilitation journey. So the question is, what is something you are grateful for today? Doesn't have to be podcast burn related or whatever. It can be anything.
Sure. I'll make a non-burn related one. I'm grateful for my dog.
We're dog people here too.
Yeah. Happy to see me, and, reminds me, inspirational, like, try to be the best person I can be every day. That, the more and more I can be like my dog.
What kind of dog do you have?
A great attitude every day,
What kind of dog do you have?
I have a Labradoodle.
Oh, they're so fluffy and fun too. I don't know if you could see, my dog
I have seen.
She felt compelled to make an appearance today.
Yes. They bring their best every day. The dog, they're always.
They do. If I could be the person that my dog thinks that I am all the time,
right? You did it better than I did, exactly.
Yeah, for sure. That's wonderful. Well, we genuinely, on behalf of, Girls with Grafts, but everyone at the Phoenix Society, we genuinely appreciate you taking the time out of your day today to join us on the podcast. It means so much. And I know our burn survivors are going to be very thrilled to hear, all of the great advice you have, but also to kind of talk through some of these questions that are hot button issues, quite often. So we want to thank you for that. We really appreciate it.
Well, thank you, Amber and Rachel, for the opportunity to talk with you today. I really appreciate it.
Yes, thank you so much.
We'll talk to you soon. Bye, everyone.
Bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.